So instead, today we're going to talk about criminalizing the sex barrier and some of the positive aspects about it with Niina. Because, you know, just kidding. No, I've got a few... This is so loud, no? It's really loud. C'est possible de less loud? Can't even speak. Oh, shit. Okay, so there's a few things to say before we start. Thank you very much. There's quite a lot of people who arrived today. It's okay? There's new people who arrived today, so if you see somebody that you haven't seen before in the conference, make the extra effort to talk to them and say welcome. You know, it can be a bit like nerve-wracking to arrive in a big conference if you don't know. So, you know, maybe, oh, this person, I don't think I've met them before. At the break, go talk to them and really try to talk to people you haven't talked to before. Check out, for those who are checking out, is at 12 in this hotel today or tomorrow. And in particular, tomorrow we have the event in European Parliament. We have around 70 people who registered, which is really, really great. But you will need to check out, because then we go to the European Parliament. I will give you more info about this, at what time we meet exactly there. It's always a bit of a process to get in the European Parliament because you have to queue, you have to show your ID, etc. So we need to be organized for this, but I'll give you more info once I get it from the European Parliament. Talking about tomorrow, there are strikes. There are strikes from the trains, the train company. So I don't have all the exact information. I'm going to see if later I can give you a little summary, but from what I understand, trains are cancelled. Belgian trains are cancelled. From what I understand, they're on strike. But if you have to go to the airport, there are other ways, like either subway or taxi. So possibly, if you have a plane tomorrow, maybe talk with some of the colleagues and you can share a taxi to avoid any issue. And ESWA, we don't have a lot of budget, and we won't be able to reimburse you if your flight is missed. So really, really, really do all that you can not to miss your flight because of the strike. And we support the strikers. Tonight, we're having a few drinks at the Hotel Bedford, which is this hotel. So you have to walk from here to there, and the drinks will be here. So you can't miss it. We're going to have some Prosecco and fruit juice and wine between 6 and 8. And voilà, stay with us, have a drink. If you have a colleague in Brussels that wanted to come and meet us, they can come at the reception as well. Yesterday we had the substance use, chemsex, drug use session. That was quite like a powerful, emotional. We talked with some people after, and there was a bit of discussion to possibly have another session about this, but in a more closed space. I think in the program we said it would be open discussion, group discussion, but that didn't really happen.
workers. And we also know, many of us from personal experience, that criminalisation and the things that come with it can negatively impact our mental health. Our panel today have researched and worked in different parts of the world under various legal frameworks, and will all have really different useful insights. So I won't talk any longer. I'll let them introduce themselves one by one and present their work. Thank you.
Okay, good morning, everybody. My name is Niina Vuolajärvi, and I'm an assistant professor of international migration at London School of Economics. And I'm here to talk about my research on the so-called Swedish or Nordic or end-demand model that criminalizes the sex buyer, but ostensibly decriminalizes the selling of sex. And in my research, I have examined how it affects sex workers in 3 Nordic countries, in Finland, Sweden, and Norway. And to just I think most of you already know what the Nordic model is, but just to kind of to remind you that it's a kind of a policy model that originates in Sweden, that in 1999 was the first country to criminalize the buying rather than the selling of sex, relying on radical feminist arguments. And kind of the reasoning behind this law is that without buyers, what the proponents of this law call the demand, there will be no sex industry or trafficking. And because women, sex sellers or sex workers are seen in this model mostly as women, are seen as victims, they should not be further punished, but rather protected. So Sweden adopted this law in 1999, and it was soon followed by Norway, Finland, and Iceland with similar types of laws. Hence, it's often called Nordic model. Although, as Anastasia told yesterday, Finland hasn't fully kind of adopted a kind of a Nordic model in the sense that it only criminalizes buying of sex from people who are trafficked or where there is a third party involved. So in my research, I examined how this policy model affects sex workers and especially their working conditions. And for this research, I did research spanning over 3 years in Sweden, Norway, and Finland that included observations and field conversations with sex workers, the police, service providers, policymakers, and activists. And for the study, I also did interviews. I interviewed over 200 people, out of which majority are sex workers. And out of these, majority migrant sex workers. And my research focused on migrants and also how kind of the immigration policies and their enforcement intersect with the kind of Nordic model law, because majority of people selling sex in the region are migrants from Eastern Europe, Russia, Nigeria, Thailand, and Latin America. And these kind of the policy relevant findings of this research are published in a policy brief by LSE Women, Peace and Security Institute, and it's available in several languages in the back. So I don't want to carry them back to London, so please take your copy or a few. So I think I have the English, French, and Spanish and Italian version there available. It will be also soon in German and in Finnish. And if you want to have the online, the PDF, just email me. You can also find it at the LSE Women, Peace and Security Institute's website. Unfortunately, the translations are not yet there, but I'm working on that. So moving to the findings. So first of all, kind of maybe this is not kind of news for you, but the findings of my research demonstrate that there's a great discrepancy between kind of the Nordic models discourse equating commercial sex with trafficking and the realities of people in the sex trade. So only small minority of those I interviewed, 6%, considered themselves to have been trafficked or forced by someone to sell sex. And this is very much in line with other international research. So intention to earn money was cited as the single biggest motivator for sex work, irrespective of people's feelings or interpretations of the sex trade. Especially for migrants, the ability to reach income kind of like impossible in the home country was the main motivation. And most of the migrants I met were highly mobile. They traveled between their country of residence and the Nordic region. So they often came to the Nordic region for a couple of weeks or months to work, and then went back to home, where many of them had children and families to support. And then they stayed there a couple of weeks and then coming to the Nordic region again. So there was a lot of kind of back and forth movement, and many of them didn't like reside permanently in the region. And many of them had also kind of like worked in various European countries before coming to the Nordic region. And the reason why the Nordic region is attractive for sex workers is because the prices are relatively high, and this makes border sex work an option if you want to reach income levels that are hard to kind of get without a higher education in your country of origin. For example, in Romania, the average take-home salary is around 700 euros a month, and this is kind of like amount that a skilled sex worker can make in a couple of hours. And I read this quote from Sorina, who is a Romanian street worker and mother of two, who I met in Oslo. And she says that I'm not crazy about money. I want what is best for my children, a normal life, chocolate, toys, normal things. But if I do normal work in my home country, I cannot live a normal life. In my home country, the system is corrupted. I could, for example, work in a bakery. The salary is 300 euros, and she had like education for this. How can I support two children with that? But money isn't everything. On the streets, you can die any minute. And when I met Sorina for the last time, she was returning to Romania, and she had been able to build a house, buy land and build a house with sex work in Europe. She also had saved money so that she could like start a business or something like this. She wanted to return to what she called the normal life with her children. She was tired of the stress of the sex work and working on the streets. So, so in a way, this research also highlights that that it's important to challenge the victimizing perspective that is embedded in the discourse of the Nordic model and see how both sex work and migration are forms of economic agency and survival. And like for Sorina, for many migrants, the lack of opportunities they faced at home motivated their migratory projects. Also for many domestic sex workers, it was a way to manage with uncertain life situations or patch the safety nets of the welfare state to finance studies or other life projects, or just to have more control over one's hours of work and kind of increased autonomy. So, moreover, the research shows that sex work is often a temporary strategic project to advance one's life, educate one's children, or finish one's own studies, build a house in the home country, like in Sorina's case. I will now move to the kind of like policing of sex work and look how the law affects sex workers. So despite the explicit aim of the Nordic model to shift attention from people who sell sex, what my research finds that they're still the main target of policing. So the sex buyer criminalisation has a minor role in policing. Instead, it functions as a smokescreen for punitive and racialized policing of sex workers that often leads to evictions and deportations. Kind of the main goal is the suppression of the market through targeting sex workers. And Niina, a Latin American trans sex worker, summarized this well in an interview. She stated, "This is a contradictory law. They kind of let you work, but they control you. In the end, they force you not to work. They say you can work, but you cannot work in an apartment because then the owner is criminal. You cannot work in a hotel because then the hotel is criminal. Here you cannot call the police if you're in trouble. Maybe somebody's violent, robbing you or something. Maybe if you're foreign, the police will put you out of the country. They say that this law is for the women, but it isn't. And to kind of understand these contradictions and also what kind of Niina is here stating, we need to look at the regulation of commercial sex in the region more in detail. Sorry. So even though Nordic countries have decriminalized the sale of sex, it is still a ground for deportation in their immigration laws. So people who are from outside Europe, so third country citizens, can be deported. Sweden has also deported EU citizens, for example, to Romania. This, of course, like thinking about that the majority of people engaging in sex work are migrants is a significant kind of detail in the legislation. In addition, the Nordic countries also have very broad third-party legislation, the so-called pimping law, whereby all assistance of sex sale is prohibited, even if it's not for profit. So even if you're helping somebody by giving a ride or for protection or helping somebody with website and you're not taking any money, that is a criminal act. And this is especially concerning thinking about the housing situation, because this means that the regular landlord or hotel owner can be accused of pimping if someone does sex work in the premises. And in my research, talking with the police and sex workers, it was evident that the police used the pimping law as a way to clear indoor sex work. And what they did was that so they first kind of like locate a sex worker through ads, like portraying to be a client. Then they're outside the flat for kind of getting a couple of clients, and then they go inside the apartment to talk with the sex worker. And what they can do after that is like they check the immigration status, so they can deport you, and they can also inform the landlord that if they do not evict the person, they are accused of pimping. And this is kind of an easy tool for the police because they don't have to do anything. They just give a call or send a note to the landlord or the hotel, and kind of like there will be no more sex buying happening in that apartment. And this law also criminalizes working together, hiring a driver or security, and in this way reduces sex workers' safety. Because if you work together and the contract is in the rental contract is in other person's name, they can be accused of pimping. And I heard stories where people were accused of pimping just by working together. So in other words, the Nordic under the Nordic model, even if it states that selling of sex is decriminalized, it's de facto criminalized through the enforcement of immigration and third-party policies. And it's also kind of important to note that the police uses these laws to suppress the sex trade through harassing sex workers, and this policing is highly racialized, targeting migrants and especially people of color. For example, like many of the kind of national white sex workers had never had any contact with the police, whereas with Nigerians, they often had several negative contacts with police and could have been turned at the border several times. Of course, this has also led to worsening of relations between the officials and sex workers, and consequently people are afraid to report violence and exploitation to officials, fearing the consequences. And for example, the first thing Mary, a Nigerian woman with a residence permit in Spain, started to talk to me in Helsinki was the fear of the police. Here we have the fear of the police. I have pressure. If you're walking on the streets here, sometimes they control you, check your ID. Okay, you're from Spain. They say that you have to go to the ticket office. You have to go back to where you came from. You have to go back to Spain or Italy or wherever you came from. They will ban that person not to come here for 4 to 5 years. That's the reason why we are afraid. If you have a European passport, they are a little bit nicer because most of the people with European passport have a job here. They have finished documents. I'm not like them. They have 2 jobs, work in the street and work in the factory. They don't get shocked like me when they see the police. So I wanted to just say, because this conference focuses on health, so I wanted to talk about a little bit about the consequences of health and well-being. We can already see from these laws how they affect, like for example, reporting violence, and also some clients know that people might be deported or evicted as a consequence of contact with police. And I had several sex workers telling me how clients had tried to blackmail them, like blackmail services from them by stating that they will report them to immigration officials or to the landlords. So it's also kind of gives tools for clients to have power over sex workers. And in general, kind of like the sex buying law reduces the negotiation space of sex workers. Clients are nervous, they don't want to reveal their identity to sex workers because they're worried that there's a police at the other end. On the streets, they hurry negotiation. All of these things hinder sex workers' safety and screening practices. Anastasia, a migrant sex worker working in Sweden, illustrated this in an interview. Because clients want to, and I quote her, because clients want to go further and further from the street and do it in their houses, it takes me 6 hours to make here on the streets what I could do in other places in 1 hour. It flips the power position. I have to focus on making them feel safe. I don't have that quote on the slide, so yeah, but thank you, yeah. In the light of these findings, it's not surprising that the vast majority of the interviewees oppose the sex buyer law and support removing criminal penalties related to the sex trade. Before I go to the conclusions, I just wanted to say a few things about the service provision. So if you listen to abolitionists, they always say that the law is just like one tool, that like the service provision is supposed to be the backbone of this policy model. And that was also the case in the Nordic model. But thinking about Sweden, like these services have not realized themselves. For example, Sweden hasn't assigned any extra money for services for sex workers after passing of the law. Instead, most of the funding has gone to policing and awareness raising. A major problem also is that majority of sex workers are migrants, which means without permanent residence permit, and therefore they're not entitled to state services. And thirdly, because in Sweden commercial sex is seen as a form of violence against women, this has meant that the service provision, the state service provision, focuses on psychological counseling and exit from sex work. This means that there is very limited access to low threshold STI testing, health or legal services, which are essential for migrants who do not have access to state service provision. So Ines talked about the Sexperterna project, and that's the kind of the only, and it's quite new, low threshold STI provision for sex workers that is not kind of like trying to emphasize the exit from sex work. And I have this quote from a social worker who kind of like describes the situation and exclusion of migrants from the service provision. And she states, if a national wants help, she could get it immediately. A place to stay, food, help with her drug abuse, everything within the healthcare. There's a lot more possibilities. We have nothing for the other ones. If they're lucky, we can provide them a ticket back to Romania. So it's not easy. It's not easy for them. So in summary, we can see the kind of the punitive consequences of the Nordic model. So sex workers are still the main targets of policing, and they have become de facto criminalized through the enforcement of third-party and immigration laws. In addition, there's also kind of ambiguous tax and fiscal policies. For example, in Sweden, sex workers are supposed to pay taxes, even if their work is not recognized, but the tax office refuses to give any kind of guidelines on how to do that. It's also kind of very evident in my research that the policing has led to kind of racialized and ethnic profiling that targets predominantly migrant sex workers, and sex workers are targets of deportation, forced evictions, and overall harassment. Studies have also showed increased stigma towards sex workers after the introduction of law in Sweden, and this affects how sex workers are treated by clients and the overall society. Many sex workers, for example, complained that the clients need much more emotional labor because you have to convince them that you're not exploited, you're not trafficked, you're doing this for fun, you enjoy this, which also kind of makes it more difficult to negotiate the conditions of labor if it's not seen as work, but as a kind of fun thing you do. So in general, the policing and client criminalization hampers sex workers' safety practices when they need to focus on making their clients safe instead of themselves. So in conclusion, we can see that despite the rhetoric of protecting women and people in sex work, the main goal of the Nordic model-style regulation is the abolition of commercial sex. And instead of buyers, this is achieved through punitive policing of sex workers that produces increased vulnerabilities for violence and exploitation, especially for migrants and already marginalized groups. So in other words, the evidence from this study shows that the Nordic model is definitely not a model to be replicated, but a rather complex regulatory apparatus designed to disrupt the commercial sex market. And I'll end here. If you're interested in the policy recommendations and the findings, you can find them all in this policy brief. Thank you.
Thank you. Yeah, as Lucas said, I think we all learned there why the Nordic model is actually very good. I think next we've got Nadia talking about Belgium and decriminalisation.
I don't need anything. Maybe a timer, but I use my phone for that. Hello. I am Nadia from UTSOPI. I have no presentation because I am very old school and I'm not very good with technology. So, I mainly work in the North District, also called Red Light District or maybe Window District. This is where we have most of our windows in Brussels. What I do in that area is mainly outreaching work and community building, as well as some local advocacy work. Health is never really a central topic in my work, nor is it an end goal, but it's still a very important topic, and it's also a great tool for me to start a conversation. When I do outreach work, I distribute health prevention materials such as condoms, and it helps to talk with sex workers that I don't know yet, to make them feel at ease and, you know, to start building a rapport. Sometimes I also help taking medical rendezvous appointment. Or sometimes I help them in getting the emergency medical card that's provided by, for absolutely everyone on Belgium ground. So health is always a great tool to start a conversation and then to get to do the rest of my work, which is community building and advocacy. Community building, because once you have a relationship started, I can explain what's available for sex workers in Belgium. We do have a community and we can support each other. We have tools available, and it's needed for me to first introduce that to sex workers in order to, for them to join us and feel like they belong to something bigger. Then I also get information from sex workers that might not have the possibility or the willingness, the time, the emotional state to share or to share their voice. And so whatever they want, they don't want, what they need, their struggle, the change they want to see, I collect that, and then together with my team, we try to translate that into political requests, and we continue our advocacy work. So I still want to mention maybe today 3 points about the relationship between decrim and health, even though, as I said, I'm not really a specialist about health. And the first one is really about that, health as a tool to start a conversation, and I mentioned those individual conversations, but also the political conversation. And we can say that health as a topic was very important and instrumental in reaching to the decriminalisation, that I will call decrim for ease of pronunciation. First, the first funding that UTSOPI ever received, and we know UTSOPI was instrumental in decrim, together with, of course, a lot of other associations, but funding was very important, and the first funding we got was from the Department of Health Prevention of the Flemish government. And the point we put forward was those that we have mentioned already this morning. In order for health prevention intervention to be impactful, it was absolutely needed that sex workers be part of the action. And that for sex workers to be part of the action and to organize, it was absolutely needed that the sector be decriminalized. So we pushed that forward. Another point that we pushed forward was, okay, health is not just about individual health, like, do I have access to health services, or do I have enough information for me to be able to lower the risky behavior I take? It's not just about that. It's also about, do I have a healthy environment to work in? And when I say environment, it can be taken, it is narrow definition, but also very wide in terms of also political environment, policy environment. Can we create healthy policies as well? That's a point we push forward, and so how can we do that? How can we create such a healthy work environment, policy environment, if sex work is still punishable? And then, coup de grâce, COVID hit, and it was a good thing when you think about the process of decrim, because during COVID, everybody in the country, most profiles were able to get government support, except for sex workers. And that very obvious image was very bothering. And we asked why. Question was because the sector was still criminalized. The only solution to avoid such a shameful issue in the future is to decriminalize our sector. Another aspect I would like to talk today, and maybe that's why you're expecting me to do, Nadia, you live in a country where sex work is decrim, so what's the impact on health? Is it good? Is it bad? Should we do it? Well, it has been only 1 year, and we don't have much data. We don't have much information, and to tell you the truth, not everybody knows about decrim. Not every sex workers know that the activity has been decriminalized. And even if they know about it, do they understand it? I had to go through a lot of trainings to understand what it is about, and I still don't understand everything. So we have a lot of work to do about that. And then even when people will understand, there is a lot of complexities that we still need to clear out. But I can mention one research that's still being done. I haven't read it, I'm very sorry, so this is second-hand information. It is conducted in Dutch, and the research is written in Dutch, but my colleagues might answer a question if you have, and it's a research project that has been requested as an assessment for decrim. When decrim passed, it was also required that an assessment be conducted 1 year later, and it's conducted in the University in Leuven by a team of researchers led by Stef Andreansens, who is an economist, Some of you might know also Magali Rodriguez, because she's like the reference. She knows everything about sex work in Belgium. The finding so far is there is a significant decrease of risky practices. I am not familiar with the methodology in its detail, but basically what they did is that they compared advertisements on redlight.be, which is the leader in sex work advertisement, platform advertisement online. They compared advertisements before decrim and post decrim, and what they see is a significant decrease of risky practices offered. What does it mean? We need to read the research. What does significant mean? I'm not sure. Is it the statistic definition? Is it another definition? And is it? What are the reasons behind that? What's the explanation? That too, I cannot really present to you today. I can just tell you there is that research being done, and so far it is showing positive things. But I have to tell you that I work on the field and I talk with sex workers every day who are pressed by financial, they're financially pressured and they don't have status that allow them to work, safely. And they tell me every day, I cannot always afford to be safe in the practices I offer. Pressure sometimes makes me accept practices that I would not have if competition was not that hard, if I didn't have to make ends meet. So there are a lot of questions that we can ask about that research, but still, this is done. This is a first step. Let's read about it in a few months, or if we are already Flemish speaking today. And then the third aspect I wanted to talk is the access to rights in Belgium. So access to rights and therefore to health and to social security, because I'm lucky to live in a country that has a pretty okay social security system when we compare to other places in the world. And so by decriminalizing sex work, a sex worker can work in, for now, one way, as a self-employed sex worker. We say here independent. That's already done. So as an independent, self-employed person, you have a lot of rights. It's not always easy to know what are those rights. You kind of have to research, you kind of have to find for information here and there. We are also trying to educate ourselves in order to share that knowledge, but you do have quite a lot of rights. Of course, they're not the same as employed, because you also have a lot of obligation, and so it makes the situation a bit complicated. But basically, you have access to social security, you have access to a lot of things. One aspect to mention is that private insurance are often an extra need when you work as an independent, and the problem is that, as you know, insurance is an industry that relies very heavily on data. Okay, whether they like you or not, that doesn't really matter if they don't have data to quantify the risk, and so to put a price on it. They're not gonna, it's all a matter of risk, and risk is quantified through data. So we don't have enough data about the sex work industry, because it's not an industry where we keep notes of everything. We're working on that, and we are right now in the process of discussing with the insurance industry and see what we can do to speed up the process or to find a solution to this problem. And then lately, we want to be able to work as employed. Not everyone wants to be a self-employed, and we need to make sure this becomes possible in Belgium to work with a contract that's closer to what we see in reality. So I'm very happy to say that hopefully, if things go well, inshallah, by May 2024, maybe the labor code will include a section about sex work. We are still reviewing the law proposal, and it is not absolutely, it has to be voted in the parliament. But if that's the case, two aspects are interesting to mention. We have asked in the law text for the 4 freedoms to be included. They're like 4 freedoms because they were called so after the speech, if there is an American said by President Roosevelt about the 4 freedoms. But the 4 freedoms for sex workers are 1, free to choose her practices, services. 2, free to choose their client. 3, free to interrupt an act at any time for any kind of reason. 4, free to choose the condition of her own sexuality. I am not entirely sure that I understand the 4th one, because for me, free to choose practices and services and clients and stop anytime kind of include that. But one example that helped me kind of visualize it is, let's say a baby is born out of an act with a client. It seems like it would be like the sex worker would be protected in this kind of cases, but please do double check that fact for freedoms on the internet or email me. Another thing that will be interesting, but that's the case for any employed person in Belgium. Once the labor law is amended, once the section about sex work is added, a sex worker will have access to absolutely everything that any other person employed in Belgium has access to. Health insurance, unemployment benefits, pension, disability benefits, child support, maternity leave, professional diseases, work accidents, meaning protection against those, yearly vacation, paid holidays. And about professional disease, there is still a discussion about, okay, but let's say I get an STD, is it from work, is it from my personal life, how are the insurance, going to this, that's still in process, I cannot answer how it will end finally. So those are good news, and of course I know what you're going to ask me. What about people who don't have access to the labor market because of their stay status? We are also working on that. My team is we are educating ourselves at the moment, studying migration law. We are not lawyers. We are not from it's very complicated. But we're doing it, again, because we want to get stronger, have more tools in order to come with the best recommendation. And at the moment, we are already able to help some people who already got at least an EU passport to already kind of regularize their situation through work, not always sex work, but it has opened a lot of conversation. People now come to us and be like, okay, Nadia, what can I do with, that's my situation, what can I do? And we already have more tools. We're just hoping that we get more and more and more tools as we go. Thank you.
Thank you, Nadia. That was really interesting. I'm sure we're all really excited to see in the next few years as more data and research comes out about Belgium. And also what you said at the end there about migrant workers is really important. We're obviously coming up to, I think we've just come up to 20 years since New Zealand had decrim. But we know that there is no true full decriminalisation without migrant workers being included in that, which they're still not in New Zealand. I think next is Kathryn talking about the Netherlands and Denmark.
Yes.
Hi everyone, I'm Kathryn. I go by Katie. I guess I can just start with an introduction before my actual presentation. But I just moved to Amsterdam December 1st from the United States. I am here as a researcher, researching the sex industry. I'm using my phone for notes. I'm not texting, but just to be able to articulate my thoughts fully. Hopefully my presentation can come up soon because I have a lot of useful information on there. But I'll just start by saying that I am here as an academic, but mostly I am here as an activist influenced by my own lived experiences that made me want to live in a world where we all feel worthy of human dignity and respect. Sex and intimacy are beautiful. They're some of the most fulfilling and important parts of the human existence. And sex workers are the individuals that make this a reality for many people. Sex workers see the best and the worst of humanity. They see people at their most vulnerable and make them feel powerful. Sex workers make the unloved feel loved, the unwanted feel wanted, and it is an absolute tragedy that we as a society can't do the same for them. And a shame that we are still fighting for basic human rights and dignity as sex workers, activists, and academics, and just people who want to make the world a better fucking place. But that's why it's so important that we're all here today together. And I just want to say that I'm absolutely honored to be here today and be given this platform to be listened to, but also to be a listener. So again, I am here and presenting as an academic researcher. I am a PhD student at the University of Pittsburgh. You can see my email address up here, so please feel free to reach out to me. This is the tentative title of my dissertation research. If you really hate prostitution, legalise it. A comparative study of sex worker autonomy in Denmark and the Netherlands. And this is an extension of my master's research that was also took place in the Netherlands. And that is a quote from one of the sex workers that I interviewed about her experiences working within a legalized system. And just a note on the language that I'm going to be using throughout the presentation. As you see in the title, I have prostitution. I use sex worker, but it's really important for me not to manipulate the language of the people that I interview. I've gotten pushback before, understandably so, of, you know, they're not prostitutes, they are sex workers. But my response is, it is not my place to tell people how they identify. And so if people want to identify as a prostitute, a hooker, a whore, a sex worker, I want to use my platform for voices to be heard in the way that they want to be heard. So why am I studying Denmark and the Netherlands? Especially, you know, I'm here from the United States. The United States is criminalized, the entire sex industry is criminalized. Very bad, we all know. But Europe is a very unique case. I kind of look at it as almost like the United States, where you have these different states and you can travel like freely within like the Schengen region if you have like a Schengen visa. And so it's unique in that there's these different legislations that all coexist within the same area. And it's important, I think, globally that we understand these different policies and how they affect the lived experiences of the individuals that they are meant to protect and affect. So just starting out with a brief history of why Denmark and the Netherlands are important for my study. So they both came to their policies in a very similar way. So in Denmark, the Act on Measures to Combat the Spread of Venereal Infections was put in place in 1874. And everyone gets venereal infections, but it was geared towards sex workers. And then in 1906, it was replaced by Penal Code Article 199, in which prostitutes were specifically named as threats to the public and constructed as women who were acting questionably. Then in 1999, it was just, oh, okay, sex work is a social problem. We don't want criminalization. It just exists. And that's the decriminalisation narrative. So it exists. There's no laws protecting or criminalizing sex work. In Netherlands, on the other hand, in 1911, the morality laws were put in place, very similar to the Act to Combat the Spread of Venereal Infections, where it was sex workers were looked at as individuals in need of control to protect the general population. And so sex workers were not criminalized, but it also was almost the Nordic model where every other aspect of the sex industry was criminalized, so brothels and pimps, etc. In 2000 then, the brothel ban was lifted, and it was, instead, sex work was legalized. But if you look at the legislation was not to protect sex workers. It was to protect victims of of sex trafficking. And I'll go into this a little bit more, but you can see in the specifics of the law that although it was meant to be uplifting to sex workers, it was really so sex workers could be regulated more. So the research that I'm doing now stems from my master's thesis research that I mentioned, and it's titled The Mirage of Sex Worker Autonomy in the Netherlands. I have a screenshot of the Google search because it is accessible for anyone. If you just go online and type it up, you can see it right there. As an academic, I need to, try and publish. As an activist, my goal is to make work that is accessible to the community. I'd be happy to send anyone a link to this, but it is just available online. So then getting into my findings. My findings really just surrounded stigma. So two separate worlds. Agency in work doesn't equal agency in society. Legalize not to secure rights, but to secure a specific narrative. And legislation that ostracizes sex workers and ignores exploitation. And I think the best way for me to describe, to go into this is to use the quotes of the individuals that I interviewed for this study. So for my interviews and what I will be continuing to do for my dissertational research, that, like I said, I am just starting right now, I record my interviews. I don't ask for any identifying information at all. You don't need to even give me a name. And, but when they're recorded, they're protected under this data security thing that I had set up through my university. And then as an extra layer of security, I don't use any transcription services. I hand transcribe by myself. So after the interview, I go back and I listen, and then I type word for word down everything. The recording is then deleted, like completely deleted. And so I'm just left with the document, and any sensitive information and names or anything is redacted. The names that you see here are all fake names that I just used a random name generator online to produce. And it's also very important for me to say that data is not the most important thing in my work. In one of my interviews, it was over 3 hours long. My interviews ranged from 15 minutes to 3 hours. In the 3-hour interview, 1 hour was completely unrecorded because the person, it was actually Mila, who I have the first quote here, she asked me, she said, there's something I really want to tell you, but I don't want you to use it. It is okay if you don't record this and use this in your work. And that part of the conversation was not recorded, and I have never talked about it again. But it's important for me to say these type of things because this work is important for many reasons, but it's important also to respect the people who participate in it. So two separate worlds. Everyone I talked to talked about, sex work felt safe for them from the inside perspective, but not outside. It wasn't the clients who were dangerous. It was the police officers that was dangerous. It was society that was dangerous. And so Mila, who had been working in the Dutch sex industry for 26 years at the time I interviewed her, said, usually the outside world of sex work is the most dangerous place, not the sex work itself. And then Julia, who was an escort through a licensed escort agency, said, but they are very intrusive. very traumatic for some people. But the consequence of that is if you are found to do sex work in a house where it is actually not allowed because of the housing corporation does not allow it, in the contract, for example, but the municipality has sort of an agreement with the housing corporation that they will be tattletale to the housing corporation if they find you doing sex work. So that means that people doing the control will tell the housing corporation of the place where you live that you are doing sex work, and that's like unlawful use of the premise of that building because, I don't know, the owner decided so, which means that you will lose your house. So again, this is a word-for-word conversation. That's why, and that's how I have it in my data. But she's talking about police officers and the control on housing. So like we see in the Nordic model almost, people, sex workers can lose their houses. It's legalized in the Netherlands, but you can still lose your house because you're not licensed to work in housing. And I had others talk about friends that they knew that even lost their children in some cases. So legalized not to secure rights. I say it's to secure a specific narrative, the narrative that the Netherlands is a very liberal place that respects the choice of all individuals. So again, two quotes. So Sophie, who was a sex worker who worked in various sectors, she described working in porn, full service, like through an escort agency, but also not through an escort agency, working as a full service sex worker by herself, which would be illegal in the Netherlands, even though sex work is legalized. But she said, so besides your Chamber of Commerce, which is registration for taxation purposes where your occupation does not have to be listed, you also had to register separately that you are a sex worker. I know an era where they did that, and that was 45 with the Jews, because Jews were registered also. And I also heard things that we had to live in suburban areas outside of the city in just one neighborhood. How fucking powerful is that? Like, if you just take a moment to kind of think of what that means, like when you're talking about registration and how alienating this is for individuals, and this is someone who worked in Amsterdam, and she's talking about Amsterdam and their rules of trying to register sex workers and move them out of the city center. That does sound familiar. That sounds grossly familiar of another group of people that were marginalized and which led to a genocide. Then Zoe, who was a sex worker who primarily worked with elderly and disabled clients, said, but the opinion was that they believed that on the city level, that almost all the girls were victims of human trafficking here, and that was because they hired an advisor who was later discovered to be a fraud. I am not sure of the specific advisor, but again, these are quotes taken directly from the interview participants. She pretended to have worked in the windows. She wrote columns in the newspapers, lots of misery and misery and misery. They were impressed by that. They hired her as an advisor, but it turned out she hadn't been in the windows at all. So again, securing this specific narrative of, you know, trying to help women clean up the city, but it does not do anything to protect anyone's rights. So then they also, interview participants also talked about how they felt ostracized and how it ignores exploitation and sex trafficking. So in the United States, where I come from, the entire narrative on sex workers' rights really revolves around human trafficking. But we need to stop human trafficking. But we need to look for exploitation. And I think that is a very global narrative. I think we hear that everywhere. But what we see is these narratives and these legislation, they do not help people who are exploited. They do not help people who are victims of sex trafficking. In the United States, I'll just bring up one of my comrades who was a victim of childhood sex trafficking. Her father sold her to older men for money between the ages of 9 and 11. And then would take her out to get ice cream. Her stepmom found out and shot her dad. and her stepmom was imprisoned, and she was left homeless as a child. And she turned to sex work, but she was a child, so it's not sex work. She was getting raped on the streets for money. And she would go to social services for help, and they would turn her away because she didn't have an adult with her or a right license. She described going to a food pantry for food as like a 14-year-old. And they said, oh, where's the adult with you? And she just ran back because that was more safe than being sent to her mom or being sent to a foster care system. And now she works as a full-service sex worker, and she is very proud of that. And she is able to live the life that she wants to live. And she does so much for individuals who do face exploitation. But it's not these places that say, oh, we want to help individuals who face exploitation. There was another sex worker who was being held by someone and forced into sex acts, and she needed a pair of shoes so she could leave the premises. My comrade went to a human trafficking organization and said, hey, can I get like $40 to help this person with shoes? She's a sex worker, but this person is holding her against her will. And they said, oh, we have to go through a whole bunch of paperwork. We can't do this, have a reply, blah, and like all these different things. So my friend went out, got her a pair of shoes, and she was able to leave, and live, because these are life and death scenarios. And with saying that, I apologize also. I know some of what I said can be very triggering. I'll get into that in the next slide. But these are the quotes by my interview subjects who describes, how in the Netherlands particularly, there really isn't a care about exploitation. It's really about just trying to control sex workers more. So Zoe said, the control and regulations are almost only designed in the meetings to fight human trafficking. It's not necessarily to help the girls. They might check your ID when you work in the window. It's about every 2 weeks. The police may ask for your ID, but they will not stop people from taking pictures. And taking pictures was one of the things that my interview subjects described as one of the most dangerous things in their work. Because as a sex worker, you should be able to choose if you are outed or not. When there are pictures that go live on the internet, you cannot choose who sees that. And a lot of these individuals are migrants, and their home countries, their families do not know. Their home countries do not permit sex work. And if their pictures went live as working in Windows, they would not be able to go back to their home countries, for example. So why isn't there more pressure on that? It's more checking IDs. And then Mila said, when talking about brothel businesses in the Netherlands, because the owner of the business has to do a really thorough screening to make sure the person is not a victim of trafficking. They want to have 0 victims. So just think of the situation of where maybe a business owner gets aware of a situation which is under the very strict law of trafficking and exploitation. What does that brothel owner of the windows do? If you come forward with it, you get a fine. If you don't report it, you leave the other person helpless and clueless. If you go to the police, you will get in trouble. If you don't go to the police, you're in trouble because there is also the law that you have to report it. You're stuck between a rock and a hard wall. And then she went on to say, the police are very, very, very forceful on every sex worker that comes forward of an exploitative situation. It might not always be trafficking in itself, but taking the share of money. They can't really force you, but they will tell every brothel owner that you cannot hire a room to this person because this person is a victim of trafficking. Then you know it's a victim of trafficking and you will get this fine. They force you to stop working. So maybe you are dealing with a person who is exploiting you, but that doesn't say anything about the job itself. Maybe you want to make money. And so going off of this in my next point, so this is an article I wrote that is in the Handbook of Sex Trafficking. It's called The Concept of Choice. You have to pay for it online, which is atrocious. So please email me and I will send you a copy of it for free. It's only a few pages long, but basically, even under appalling conditions, people exercise capacities for choice and action that deserve respect. Why is it that sex workers, if they face a situation where they are not treated correctly, it all goes back to human trafficking, and then there's this paternalistic thing, oh, we have to protect them. They can't make the choices themselves. They don't know what's right for them. So I haven't started my research in Denmark yet, but when I lived there, I worked in an organization called Nightlight Cafe, and it was for street workers to come into during the night hours just to get a coffee or a sandwich. And I talked and I interacted really not about the conditions, but most of these women were from Nigeria, and under Danish law, they would be considered trafficked. And they were trafficked. But they came to Denmark to work in the sex industry. It wasn't the sex work that was bad. It was the conditions of the sex work that they were working in. And I think that's something that needs to be talked about a lot more, is we want to make sex work a safe place. And to make sex work a safe place, that's not eliminating sex work. It's eliminating forms of exploitation that can be present, but that doesn't mean that people who have experienced exploitation no longer have the right to make choices about their lives. And sex workers should, and from what my interviews told me is, you want to stop I remember one of my interview subjects told me, if you want to stop human trafficking, talk to sex workers. We know how to find someone who has been exploited. We know what it's like. And I'll conclude with that. That is my email. That is my phone number. So again, I would love to send you that article if you're interested. I'm open to questions, comments, and really anything. I'm in the Netherlands now. I'm trying to get my visa so I'm able to continue doing this work. And I would love to talk to anyone and everyone about it, and hopefully be able to get more interviews so I can use my platform as an academic to continue highlighting these stories.
Thank you, Kathryn. I'm definitely going to be emailing for a copy of the concept of choice. I think next we've got Nenad talking about Macedonian sex workers and health rights inequalities. Thank you, Nenad.
Hi, I'm Nenad Micov. I come from North Macedonia. And I work for STAR, the first sex workers collective in the Balkans. And today I will be talking to you about the health care inequalities among sex workers in the country through the participatory research that we conducted this year. Okay, until the presentation is set up, I'll just give you a brief overview of the national context in terms of the criminalization of sex work. So sex work is still criminalized, is still illegal in North Macedonia, and it is considered a misdemeanor under the law on misdemeanors against the public order. The fines were much bigger, so if they find you on the street doing sex work, they could fine you, and the fines were much bigger. Oh, thank you. Last year, in 2002, without any consultation, without any expert involvement or community consultation, they just simply reduced the fines. We don't know why, but then we realized it's probably some sort of general policy of lowering fines and offenses for some crazy reason of our crazy government. We never really understood why. But anyway, it is still a misdemeanor, and also In the criminal code, it is criminalized mediation in prostitution, which means that everybody who mediates in some sort of way for doing sex work will be criminally charged. I would also like to say a word about prostitution. This is the official translation from the criminal code, so this as the law in Macedonia does not recognize yet sex workers, that's why this wording is used. So criminalizing voluntary sex work and activities related to it creates a variety of challenges that sex workers face, including stigma, discrimination, and limited access to social, healthcare, and legal services. All this contributes to a higher degree of marginalization and vulnerability of sex workers, which renders them even more vulnerable to exploitation, violence, and abuse. Sex workers are likely to be hesitant to report this violence or seek help by law enforcement in fear of legal repercussions or additional harassment. This creates barriers for accessing healthcare services, including sexual and reproductive health services, HIV prevention and treatment, and mental health services. The only protection that is currently provided for sex workers and where they are recognized under the term sex workers, and mind you, it's only female sex workers because in Macedonian language, the nouns are gendered. So in the law, you have female, it can be translated in English, it's female sex workers who are recognized for the first time since January 2021 under the law on prevention and protection of violence against women as a vulnerable category. Furthermore, but they're just recognized, nothing else. That's it. It just says like vulnerable categories, and they're listed like everyone who advocated for a gazillion years to be included. Now the actual work is about to be done. Furthermore, the law on prevention and protection against discrimination, which was a disaster of a law and a real battle to be adopted, finally came to some ridiculous formulation of belonging to a marginalized group, which is the only ground of which sex workers can use if they want and if they feel discriminated and if they want to press any processes. What has been the most helpful for the female, male, and transgender sex workers in North Macedonia was the national HIV prevention programs, which were introduced almost 15-20 years ago and implemented by the Ministry of Health. And when it comes to this, they do receive services and they are recognized as rights holders. According to the latest population size estimation, which was conducted in 2018 with a respondent-driven sample, there are around 3,000 sex workers working in North Macedonia. Mind you, this is before everything, before all the crises. And just to have a notion, Macedonia's total population is 2 million people. So as I mentioned, the HIV services provided by the civil society organizations were introduced by the Ministry of Health between 2005 and 2017 with the support of the Global Fund, which in this period of time invested $25 million to build a national HIV response. Since 2018, when the external financial aid ended, the government of the Republic of North Macedonia formally assumed the obligation to finance the HIV prevention services and committed in its policies to safeguard their sustainability in the future. Thanks to these programs, which were implemented on the ground level by civil society organizations, sex worker-led organizations, and other key affected populations, in Macedonia, we were able to maintain full control of the HIV epidemic among people who inject drugs and among the sex workers, and to be one of the lowest, to have one of the lowest infection rates in the region, which is a huge success. I mean, we have not had a new HIV cases among sex workers in very, very, very long time, which proves of the effectiveness of this program, which we are very proud of. But as the government took over the financing of these programs, this is not so bright and so good as it was, in a very scandalous and frivolous manner, again, without any expert discussion, without any community consultation. The Ministry of Health decided to cut 40% of the budgeting allocated for the HIV prevention program for 2022, and kept doing these arbitrary reductions and poor policy health decisions to date, endangering the health of at least 10,000 citizens from the marginalized communities, sex workers including. So we decided to see what and how the sex workers feel, what do they know, what do they need in regard to their healthcare rights and social rights in the country. And we did this through research and conducting a questionnaire, which was developed by ESWORN, which is another network, sex workers advocacy network for Europe and Central Asia, yeah. And we interviewed 50 sex workers from North Macedonia. We identified participants based on the convenience sampling method, and we tried to ensure to have a representative sample and diversity in demographic characteristics of the participants. Of course, they had to be legal of age, to be engaged in sex work, and to reside in North Macedonia, and of course, to consent to participate in the research. The findings. 56% of the respondents answered that in Macedonia there is know that there is a national healthcare insurance that covers sexual and reproductive healthcare services. 36% of the surveyed sex workers do not know that there is a healthcare insurance that covers the access to these services. Out of the first ones that are informed of healthcare services, only like a third, as you can see from the numbers, are aware of individual specific healthcare services such as family planning and contraception, care during pregnancy, safe abortion, post-abortion care, cervical cancer care, hormone counseling, and referring to other services for transgender sex workers, which taken out of the 50, these are really, really, really low numbers. Then we asked them, where do you access these services? So most of them, as you can see, I don't know if you can see, I guess, yeah, okay. Most of the sex workers interviewed access these services by either services led from the community, from the only sex worker organization, or other services for the community that are provided by other civil society organizations. Less is accessed in the private clinics and hospitals and the state clinics and hospitals. Why is this? Is because there are intersectional barriers. We've realized that there are intersectional barriers in the access and exercising social protection rights in the healthcare rights, because this was I have a mistake in my presentation. This was a very large research, so we had also one part for the social and one for the healthcare rights. So yeah, but there was intersectional barriers in the access as well as to accessing healthcare rights. Discriminatory treatment full of stigma on various grounds such as nationality, educational grounds, moral and ethic reasons. The treatment of sex workers was different and noticeable if they were accompanied by a representative from the civil society, by a peer or someone else. Main perception among all respondents is that not a single sex worker would attempt to seek services alone or by themselves if the public healthcare workers knew that they are sex workers. In their experiences, they also recognize the phenomena of racism, xenophobia, homophobia, and transphobia, and according to the respondents, the LGBT sex workers are highly affected, transgender and gender diverse sex workers are highly affected, and as well individuals who use drugs. These are some of the quotes from the interviewed sex workers, which speak volumes about what they go through every time they need to access any healthcare service. When I go to the clinic, I have a problem with discrimination and ridicule because of my appearance, which is why I'll always go with someone from an NGO and because they respect me, by a transgender sex worker. When I go to the gynecologist, apart from the exam, which is routine, I don't get any counseling or information about my health. But when I go to the NGOs that offer these services, the approach is very different. I am by myself, they know I'm engaged in sex work, and besides the medical exam, I also get counseling and education. Female sex worker. I'm Roma myself, and I'm discriminated because I'm Roma and because I'm illiterate. They are rude with me, they don't listen to what I ask, they don't allow me to understand. The same things happens with the others, especially with gay and trans people, a Roma sex worker. Another topic that we wanted to research and to see are the perceptions of the availability of services for victims of sexual violence, which are recommended by the WHO as a standard. And to the question which interventions are available for victims of sexual violence, only half of them knew that there is some kind of primary support and there is some kind of psychological support and intervention. Very little of them knew, around 20%, about emergency contraception or PEP, and a very big number of around 40% didn't even know that this existed and they could access at all. Findings indicate that there is a substantial change is needed when it comes to accessing healthcare rights, such as delivering sexual and reproductive health services in public health setting. Information that reaches sex workers regarding their healthcare protection is limited, insufficient, and incomprehensible. Necessity to reduce prejudice and the influence of personal views and perceptions among public healthcare workers in order to eliminate stigma and promote continual professional development, especially when it comes to working with marginalized communities. And existing laws that criminalize sex work and penalize sex workers create an environment in which sex workers feel unsafe to seek healthcare services and to report acts of crime, including violence and other forms of use. And of course, at the end, we produced some recommendations for our decisions and policymakers in North Macedonia, which are listed here, to maintain and expand the range of sexual and reproductive health services offered by the civil society sectors in improved cooperation and support by the state, because this is where the sex workers trust to go and they wouldn't go to the state clinics. To increase the budgets for the sexual and reproductive health programs in order to improve the services offered by the public health care institutions in the civil society. To provide healthcare services via competent institutions without discriminations. to develop easy-to-read guidelines to healthcare policies, as well as protection and support guidelines for gender-based violence in an easy and comprehensible language for sex workers in line with their capacities and needs, and to adopt a legal framework which would provide equal healthcare protection and labor rights for sex workers, decriminalize sex work. The research report is available on this link. I don't know if you could see it much, but you will be able to click this link and read it in English if you want to know more about it. Thank you for your attention.
Thank you, Nenad. I'm really excited to read that as well. A real testament, I think, to the work that grassroots and sex worker-led orgs can do, especially in countries where they're really restricted by criminalisation. Our last speaker on this panel is PG. Paola, you ready?
Hello, everyone. My name is PG. I'm an activist in sex workers' rights for about coming up 20 years, and I'm an academic as well, a researcher, and yes, and I've lived and researched in many places, and I'm so happy to be talking about something positive today here. We were mentioning before, Nadia mentioned the fact that we don't yet have data on decrim. Thank you. Yes. For Belgium, and we are longing to have some, but we do have other data, and this is what I'm going to talk about today, is the health impact of decriminalisation on the lives of sex workers in contexts where this has been the case for about 20 years. So, we know that sex work decriminalisation is called for by ourselves, by sex work organizations, by UNAIDS, by human rights organization, public health research. There is wide consensus that this is the best way to uphold the rights and health of sex workers and well-being. So far, however, only 5 jurisdictions worldwide have adopted decrim, and only 2 of those have done so for like about over 20 years ago. These are the state of New South Wales in Australia, which adopted it in 1995, and the most known example, New Zealand, which was 2003. There are the other 3 were adopted in Australia, 2 other states of Australia, Northern Territory and Victoria, respectively 2019 and 2022, and Belgium last year, as we know. So why did I decide to do this research? Is because we have a lot of data on the negative impact on health of criminalisation, but we didn't have a clear summary and clear overview of what are the health impact of decrim, and we really need it for advocacy. So we decided to do this scoping review because we had a lot of different research in Australia, in New South Wales and New Zealand, but it was very, very diverse types of research, direct research with sex workers, but some was quantitative, some was qualitative. It was impossible to do a systematic review, so a scoping review is a very detailed overview of a broad topic that reviews very diverse literature. It's a scientific method as well, so it's by no means less reliable. So we decided to include all research that directly collected data amongst diverse sex workers on the impact of decrim on their health and well-being. So in these 2 states. I want to add something that is important, and it has been mentioned by Niina, how violence has to be central in discourse around health. So that's therefore looking at how, in a context of decriminalisation, clients have access to sex workers have access to justice, and they are less vulnerable to blackmailing by clients. It means that they are less exposed to violence. It means that they're less exposed to the violence of of rape or other sexual abuse during sex work, because they can report it. So violence is very important, and it has to be a central point of every discourse around health. So it is included here, but we focus a lot on sexual health, but violence has to be one of the very important topics when we talk about health of sex workers. And it's more political than just talking about sexual health. So we reviewed, going back to the research, we reviewed 52 different papers, including 33 peer-reviewed journal articles, important for scientific evidence. And this is also important that they were conducted among cis and trans women sex workers, cis men sex workers, national and migrant sex workers, and First Nation sex workers in both jurisdictions. And also among different forms of sex work, so street-based sex work, indoor sex work, escort and brothel venues, and massage venues. So this is available, the paper is available this year finally online to everyone. This just to let you have a glimpse in the variety of research that we reviewed. And we wrote there the type of research data and with which sections of sex workers and how many, and if it was interviews or clinical data or surveys. These were the research that we reviewed in New South Wales, and these were the different pieces of research in New Zealand. So results in New South Wales of the review. The rate of condom use rose incredibly after decrim since 1995 and steadily. So that 90% of sex workers, and this includes cis and trans women, cis men, migrant and non-migrant sex workers, above 90% report regular condom use at work. I'm just mentioning a few of these results just to give you numbers, but there is way more details in the article, obviously, but it can be boring, so I'll just mention a few. Just this. And there is, this is very important, there has been a steady increase in engagement with publicly funded sexual health services among all different categories of sex workers, but also particularly migrant sex workers. Due to, and I'm talking about sexual health services that are mostly peer-led and peer-based. And since decrim, these services have been funded, like UTSOPI is now, have been funded, but also they could actively reach out to all of the venues that were before criminalized, so they could actually get in touch with the sex workers. That's why it's directly linked to the improvement of the health outcomes. And also they employed what is called in Australia called peer outreach workers, and called stands for culturally and linguistically diverse, one of these terms, meaning from different backgrounds, migrant backgrounds, linguistic backgrounds, and also First Nations sex workers are being employed to do this outreach work, and this has proven by research to be very effective in order to reach out to diverse sex workers. Also very important, linking violence and coercion to health, trafficking decreased radically, and this is all based on research, right? Trafficking decreased radically in the past 15 years, and research linked this to decrim and to an improved access to legal pathways to migrate and get a work visa that included the right to work in the decriminalised sex industry of New South Wales. So this is also really important for our advocacy for decrim around the world. But of course, not everything is positive, otherwise we would be bored. Unfortunately, there are still regulatory concerns in New South Wales, so it's not to be called full decrim, because there is a persisting illegalization of locational aspects of street-based sex work. What does it mean, locational aspects? You are not allowed to engage in street-based sex work in front of churches, schools, or within a range of kilometers, I don't remember how exactly, which, you know, it's a way to push out this form of sex work because of gentrification, because of morality issues. There is hardly any street-based sex work in New South Wales left. It's a very, very small percentage, and it is the most marginalized, again, because of these issues. And it's much harder for for outreach services to go and reach out because they're pushed to the outskirts, to areas where it's hard to connect with them. So also another problem is that it's very difficult and costly to get the council authorization, which is not a license, but it's an authorization that does not involve the police as the regulator, but it's still very hard to get this authorization for sex work premises. So there is a lot of massage venues that don't have this authorization, and where sex work takes place. And these are very much targeted by council inspections, and they're not accessible to outreach workers because they have to, put on the facade that no sex is happening there. They're not being criminalized, so it's not as bad as we see everywhere else, but it's still shit. Like it should be easier to get an authorization. On the other hand, it also protects some people from stigma that's still ripe, of course. So it's a bit of a complex area where some people don't want it to be actually authorized because they want to tell their families and the outside world that they work in a massage parlor and not have brothel advertised in front of it. So it's a bit complex, the line there, but it's definitely still a concern to be worked on. So we just claim that council inspections should not take place. This is what the requests of sex workers are in Australia. So no inspections for these places. But access, yeah, anyway, sorry. So also the respect of occupational health and safety in all sex work venues, even authorized ones, has to be improved. There has been research showing that it's really the conditions are not very good, and things are improving. Sex worker rights organization and the SWAP services are starting to collaborate with the Minister of Health to collaborate on how to ensure health and safety, good working conditions, good venues, condoms on the premises, all this for criminalized situations, luxuries, but very basic needs for sex worker premises. So they are being improved as we speak, probably. But that's research pointed at lack of good conditions there. What are the results in New Zealand? New Zealand also very high rates of condom use and very regular sexual health checkups among non-migrant sex workers, and huge improvement of quality of life, protection from social harm, access to justice, in particular for this small percentage in New South Wales that was vulnerabilized. In New Zealand has improved their quality of life greatly, and it's street-based sex workers who are in New Zealand the majority of Maori, Pacific Islanders and transgender sex workers and people who inject drugs. And research has shown really great improvement in their access to health and outreach services and trust in the police even. There is also in New Zealand, like in New South Wales, an exemplary national peer-based sexual health and social support service. This is the New Zealand Prostitutes Collective that has been recently renamed, sorry for not having updated the slide, to Aotearoa New Zealand Prostitute Collective, which is the Maori name of New Zealand, of the territory. So, and they collaborate with authorities continuously to ensure compliance with operational health and safety in sex work premises, and it's working. It works really well in New Zealand. And also, it's not on the slide, but also they also employ diverse sex workers, First Nations, the diverse gender, and also migrant sex workers from different backgrounds. And here we come to the regulatory concerns in New Zealand, which are even bigger by size and by meaning, and by size, not by meaning, than in New South Wales, because there is a persisting illegalization of not only undocumented migrant sex workers, because this is also the case in New South Wales, except Australia and New Zealand have got such tight borders that there is hardly any. It's impossible to be undocumented there. Like it's tight inner and outer borders. It's really hard. So it's actually the persisting illegalization of even temporary migrant sex workers who have the right to work in New Zealand. And it's the majority of migrants in New Zealand. So obviously, they would be the majority of migrants in the sex industry as well, because the majority of all migrants in New Zealand have temporary work visas that are linked to their student status or work on holiday, it's called, these visas, other visas. But it's not that difficult to get those if you have the money. Voila, they are completely criminalized in New Zealand, which means they risk deportation. They don't risk imprisonment, but they're just deported, violence and blackmail by venues holders and clients. And they are really not happy to access health services. Only the NZPC, they would access them because they do a lot of outreach with migrant peer workers. So the research, this is again all based on research, previously done research. They tend to access more those services, but they wouldn't go to a doctor. They wouldn't go, like we had, it's also because I participated in some of the researches that I reviewed. So we interviewed people who said were on the bridge of dying and they wouldn't go to the hospital for fear of being deported, of being recognized as sex workers. So it's really a massive barrier to health for a large section of the whole sex industry in New Zealand. And it's not enough talked about. So I stress this a lot because we are all fighting for decrim, so it's very important to have this in mind. Good news is that the successive forms of decrim since then, none of them have anything similar about temporary migrants. So the lesson is learned in New Zealand. I'll go back. The lesson is learned in New Zealand, and the NZPC and sex worker rights organization are constantly lobbying and working to repeal this called Section 19 that excludes migrant sex workers from full decrim. So they didn't want this from the start, so they advised against this section when it was introduced as a way to protect victims of trafficking. Again, totally paradoxical. So you criminalize and expose them more to exploitation and violence in order to protect, it's just to protect the facade of New Zealand, say, no, but we have this section, we are not decriminalizing sex trafficking because we still decriminalize migrant, it's crazy. But we are working again to repeal it. Right, so results in both settings. In both settings, clear overall improvement of health and well-being for the sex workers that benefit from decrim, and clear overall improvement of access to and engagement with health services amongst diverse sex workers. In New Zealand also increased engagement to access to peer services, even for migrant sex workers. So this is another very important point because abolitionists always say, oh, but the sex industry is going to exponentially grow and there is going to be so much sex work everywhere. If you decriminalize sex work, no increase in the size of the sex industry in neither New South Wales or New Zealand. This is again research data done through a variety of methods. Obviously, it's really hard to count the size of the sex industry, but this is what research has shown. Research looking at online platforms, looking at client forum, looking more at the client side. Also important for arguments to support decrim. So research really clearly links all of these improvements to decrim and to the development of peer-based outreach service provision by and to diverse sex workers. So these are the recommendations at the end of this big survey, big review, is that we need to fund peer-based services. And this applies to any context, even when decrim is not yet accomplished. So absence of specialized mental health services was found also. This is a negative result. in terms of there is still a lot of stigma relating to mental health and sex work. And stigma in society is also has also not disappeared. It has decreased, but it has not disappeared. So there is still work to be done there as well. But we all know that it's a necessary first step and not the ultimate solution to all problems. Decrim, I'm talking about. So conclusions / recommendations. So full sex work decriminalization is this necessary first step to just start addressing health and social inequalities among sex workers, but it does work. Evidence strongly supports also the full decriminalization of all forms of sex work, including street-based and migrant sex work. And it's great to hear that UTSOPI is also working on trying to be as helpful as possible, even in cases of undocumented migration, how to improve access to health and rights for all sex workers. It has to be the bottom line of any advocacy, but because as long as parts of our communities are criminalized, we will all be affected and stigma will continue to be rife. So another conclusion, I'm sorry I switch into activism sometimes, but no, let's go back to the research. So, so research shows that peer-based service provision by and to diverse sex workers should be promoted and funded, and I said it before, but I'm never tired of saying it, and that stigma needs to be further addressed and challenged in society at large, and particularly in mental health provision and in all health provision, by trainings to, and by sex worker-led organization to healthcare, police, well, police is a bit more of a controversial one, but trainings. And thank you.
Hiya, thank you. Yeah, that was really, really interesting. I particularly appreciated the little bit about how there's been no increase in sex work under decrim. A little reminder to people who accuse decrim advocates of being the pimp lobby. We don't have any time for questions today because we all want a coffee break. But they'll all be there and here for the rest of the day if you want to corner any of them for questions. Can we have a big round of applause for our panel today?
Hi everyone, so we're really late, so we're only going to have a 20-minute break. So go drink lots of coffee and come back in 20 minutes. And thank you, Leila, for stepping in for chairing.